We call there's two ways of looking at it. It's called progression-free survival and overall survival. These are the terminologies that are used in the clinical world of cancer, and they represent the approval of drugs through the Food and Drug Administration. If you have a drug that improves progression-free survival, progression-free means it looks like the drug is working on the tumor. Because, the tumor, you can see it gets bigger and bigger and more lethal and more lethal. And if I see it not growing nearly as much, I say, wow, look at it's slowing what we call traditional progression, okay? It's called progression-free survival. And then you have overall survival. So you have two ways to approve drugs mostly for cancer, right? How does it work on progression-free survival, and how does it work on overall survival? Well, they stopped looking at overall survival. Now somebody's going to bark and say, well, bottom line is mostly progression-free, which means that the patients, it looks like the tumor is being effectively managed, but they live only a couple of months longer than they would have if they didn't use this drug. So therefore, it's approved, and that as opposed to overall survival. You're only living you lived 2.5 extra months. The tumor looked like it was managed pretty well, but your overall survival is this much, but you didn't see the tumor growing. We're going to approve that drug. So a lot of the new drugs that we're giving do a really good job at progression-free survival, but they do a horrible job in keeping people alive much longer, which ultimately is what you want to do.